Let us take a moment to acknowledge the importance of the land we each call home. We do this to affirm our commitment and responsibility to improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. We acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people who call this nation home. Let us now join in a moment of reflection to acknowledge the harms and mistakes of the past and to consider how each of us, in our own way, can move forward in a spirit of reconciliation and collaboration. And just for everyone's information on this meeting this afternoon, OARC has taken we've looked into education, better educating ourselves on truth and reconciliation and on issues of importance to Indigenous peoples in this province. And one of the ways that we have are contributing or trying to be part of truth and reconciliation is through understanding different languages and promoting Indigenous languages. So if you go onto our website, under the Resident Bill of Rights section, you will find several Indigenous languages that are spoken in the province, around the province, and are there for your use. So if you are living or working or visiting a home where there are people who speak any of the Indigenous languages and other languages as well, have a look at our website and see if one of them there is one that applies to you. Thank you. So as I mentioned, this is a little bit of a different format. It is Zoom meeting, which means, again, we can all see each other. And so some of the differences are that we don't have a question and answer box. Rather, we have a chat box. So you're welcome to put comments and questions in the chat box. We will be monitoring it. We just ask that all of the comments that you do put in the chat box are respectful and productive so that we can maintain a professional and inclusive environment. Thank you. The webinar is being recorded and will be shared following via email. Something else that's a little bit different is since we can all see each other, we would love to have a group photo taken at the end. So if you're not comfortable being in the group photo, we'll let you know before it's taken. It'll be right at the end. But if you prefer not to be captured, you can either turn off your camera or press the exit button. It'll be right at the end, so you won't miss anything after that. And as always, there will be a pop-up screen that comes up when you close the window with an evaluation for this webinar. Your feedback and suggestions are so important and appreciated, and we'd love to capture your thoughts about how things went today. Okay, okay. So with that, I would like to turn it over to Peter Kaftarian, who is the Deputy Minister of the Ministry of Long-Term Care and the Ministry for Seniors and Accessibility, who will offer opening remarks to kick off today's session. Over to you, Peter.
Thanks very much. Good afternoon, everybody. I'd like to thank the Ontario Association of Retirement Residents Councils and the Family Councils of Ontario for inviting me to attend today's webinar. I'd also like to acknowledge the resident leaders and council members who have taken time out of their busy schedules to be with us. During my visits to long-term care homes across the province, and I was at 2 this morning, so if anybody is watching from Ivan Franco or Villa Colombo, hello. It was great to tour your homes, and I got to interact with some residents and say hello this morning, and it's great to be here this afternoon. And when I'm on these tours, I'm very humbled by the thoughtful conversations I've had with residents and the councils. And it's truly heartening to see how everyone is so committed to strengthening the care long-term care residents receive across the province. I also want to thank Dee Tripp, Executive Director of OARC, Sam Peck, Executive Director of FCO, both of whom unfortunately can't be with us today, and your teams for so thank both of you and your teams for your continued leadership excellence, willingness to collaborate, and your advocacy on behalf of Ontario's residents and families. You continue to inspire those of us in the long-term care sector to do better. I'm seeing many familiar names and faces on the call, but for those of you I haven't had a chance to meet, my name is Peter Kafterian. I'm the Deputy Minister for both the Ministries of Long-Term Care and the Ministries for Senior and Accessibility. I'm delighted to be joined today by a panel of Assistant Deputy Ministers from the Ministry of Long-Term Care. Our collective role, working with the Minister and her office, is to build a system where residents and soon-to-be residents receive the best possible care and the highest quality of life. That's why meetings like this are so important. The bi-monthly meetings between the Ministry, OARC, and FCO are an important forum for meaningful dialogue, and our Ministry values the honesty, clarity, and lived experiences that residents, families, and their councils bring. Your unique insights help us to ensure that our work remains grounded in what matters most to people living in long-term care homes. So today's webinar brings together leaders from Ontario's Ministry of Long-Term Care, residents, their families, long-term care resident councils, and we will share updates on our current priorities and the work we're doing to support long-term care residents across the province. Your feedback is very important to us as we look to improve our policies, programs, operations in an effort to better support the quality of care residents in long-term care homes receive. Now, I just want to take a quick moment to introduce our panelists and my colleagues from the Ministry of Long-Term Care. So you'll hear, you're going to meet Jeffrey Graham, who's the Chief Administrative Officer and Assistant Deputy Minister from Corporate Services Division, Sandra Lawson, who's the Assistant Deputy Minister of the Operations Division, Sean Court is Assistant Deputy Minister of the Policy Division, Gillian Stevie is the Assistant Deputy Minister of the Capital Development Division, and Emily Cohen-Henry is the Assistant Deputy Minister of the System Planning and Priorities Division. And I'd like to call upon our panelists to share their updates on the work their teams are focused on and how we're working together to improve long-term care across Ontario. Thank you.
Thank you so much, Deputy Minister Kafterian. It's really wonderful to have you and your colleagues with us today. And a very warm welcome to everyone joining us this afternoon. My name is Melissa McVie, and I'm so pleased to be here with you today as wearing a new hat as Acting Executive Director for the Ontario Association of Residents' Councils. And this is, as Stephanie mentioned earlier, this is such a special opportunity for us to be together in this Zoom meeting format where we can see everybody's faces and we can really connect in a different way today. So looking forward to this next 45 minutes or so together. I wanted to share, we had close to 400 registrations for today's session, which signals to me and others that people are really looking forward to this conversation. Each registration for OARC webinars usually translates to several people tuning in at different long-term care homes and in different settings across the province. So as you look around the Zoom room, you will see that there are individuals, but also small groupings of residents tuning in common spaces, and we're so encouraged by this turnout. From our latest registration numbers, I think from yesterday, we are anticipating that today's session will be reaching over 400 team members working in long-term care, 321 residents, 91, probably more than 91 family council members and caregivers. So really, truly, from the bottom of my heart, thank you for being here, for joining us live or for catching the recording a bit later. I'd like to begin by sincerely thanking our partners at the Ministry of Long-Term Care for embracing this opportunity, really truly embracing and welcoming this opportunity to meet with residents, families, caregivers, and other supportive partners in long-term care, and for taking this valuable time to shed light on the important work that you do at the government level. As we heard from Deputy Minister, OARC meets with our ministry partners on a bi-monthly basis to elevate issues of importance to residents and to engage in important reciprocal sharing. And these touch points are very productive and meaningful to the residents and the OARC team. We are grateful for the ministry's commitment to resident and family engagement and for the ways that you continue to listen to residents, not only hearing their concerns, but valuing their lived experience as an important guide for planning, policy development, and priority setting. We are especially pleased to be co-hosting today's webinar with our friends at Family Councils Ontario, The partnership between resident councils and family councils brings together complementary perspectives, residents speaking from their own lived experience, and families and caregivers advocating alongside them. And together, those voices help paint a more complete and honest picture of life in long-term care. And with that, it's my pleasure to turn things over to Leanne from Family Councils to share a few words. Thank you, Leanne.
Thank you so much, Melissa, and welcome, and thank you for joining us today. It is an honor to be here, and as Deputy Director with Family Councils Ontario, and with more than 5 years at the organization, I bring both system-level and lived perspective to this role. That perspective is grounded in over 20 years of frontline experience in long-term care, along with my own experience as a caregiver, which continues to fuel my commitment to strengthening the system. Through our work in collaboration with OARC and the Ministry of Long-Term Care, that commitment continues to deepen. We are proud to co-host this event and to bring together those dedicated in improving long-term care. These moments matter. They create space for connection, shared learning, and meaningful progress. We acknowledge the Ministry of Long-Term Care for their ongoing support, which enables us to contribute to policy, inform system planning, and ensure that family voices are reflected in decisions that impact care. Family councils play a critical role in building a more responsive and accountable system. Through our work supporting over 500 family councils and more than 2,500 members, we hear a clear and consistent message. Transparency, accountability, and strong enforcement are essential to build trust. Open and honest dialogue is not optional. It's necessary to drive improvement and keep the lived experiences of residents and families at the center of care. We are encouraged by the Ministry's ongoing engagement and look forward to continuing these conversations. Forums like this are just not valuable, they are essential. Finally, sincere thanks to our friends at OARC and residents' councils across the province for sharing their insights and for their continued leadership and collaboration. Thank you for your commitment to improving long-term care for all. Back to you, Stephanie.
Thanks so much, Peter, Melissa, and Leanne, for the opening remarks and for setting the context for today's discussion. We'll now move to our fireside chat with the Assistant Deputy Minister panel. We'll start with Assistant Deputy Minister of the Policy Division, Sean Court.
Hi, everyone. Thank you for participating today, and I'm sure in advance, thank you for your questions as well. My name is Sean Court. I'm the Assistant Deputy Minister of Long-Term Care Policy, but really that's a bit misleading because I spend about 85% of my time working on health human resources. So whether that's providing funding to the homes so that they can have more direct hours of care for residents, or helping to remove barriers to hiring, professional standards. A wide range of work occurs across my division. The key pieces to update you on today are the government made a commitment in 2021 to achieve a target of 4 hours of direct care per resident per day. And over the last quarters of this fiscal year, we now are on track to hit those 4 hours of care, which is really great. The government has made significant investments, but lots of hiring and training and onboarding has taken place across Ontario's more than 600 long-term care homes to bring new staff into the fold to help support you in your day-to-day. What we have seen is that our headcounts are up really, really significantly in terms of the number of staff that are available across the system. To help support recruitment and retention, we've launched a number of training and education programs. Our two newest programs are called Nursing Join and Nursing Pledge. Join is recruitment incentives, and Pledge is a program focused on nursing mentorship. So is there a way to keep our talented and very qualified and expert nurses in the home providing mentorship as we have new nurses who are joining? We have seen historic interest in our PSW training program, in our recruitment and retention programs, and we're working every single day with our training partners to make sure that homes are participating in those programs and are leveraging available funding. And then I think the last thing to flag is that at the start of this year, so for April 1st, we're doing some really significant work to reduce the number of funding programs we have. Not to reduce the amount of funding, but to reduce the number of discrete programs. So to reduce the burden on homes who have to navigate all of our different funding programs, we're putting more and more of our funding together. And the goal there is to be able to maximize every single dollar that the government makes available for long-term care. So I'll pause there. I'm sure you're going to have questions when we get into the Q&A portion, but I'll turn it back over to Stephanie and Melissa.
Thank you, Sean. Next up, we've got Emily Cohen-Henry, the Acting Assistant Deputy Minister of System, Planning, and Partnerships Division. Emily.
Hi, thank you everyone, and thank you for having me. It's a real pleasure to be here today. I was with the deputy this morning touring 2 of the homes. It's always wonderful to be welcomed into folks' homes and to see so many of you on the call today. So really excited to provide some updates about the work that's happening in my division. So my division has a very long title that our host here didn't stumble over. I often do when I introduce myself. So System, Planning, and Partnership. And really, our division is looking at how we can work with partners across the health sector, across the long-term care sector, and improve the quality of care that's offered to residents in homes, as well as looking outside the walls of a long-term care home and thinking about how we can support seniors that are aging in the community who might end up in long-term care. We know that, our population is aging. We're seeing an increase in medical complexity for residents that are entering long-term care and, increasing demand and broader demand for specific clinical services within long-term care homes. So I'm going to highlight a few initiatives, a few updates of some of the work that my team is leading, looking to improve access to clinical services in the long-term care sector. So one program we have is called the Improving Dementia Care Program. And this is a key program the government's taking to strengthen quality of care and improve dementia-related outcomes. It is a 3-year, $9 million investment, started in 2025, going to 2028. And it has the potential to reach approximately 5,000 residents across nearly 50 long-term care homes. In its first year, the program is supporting 17 long-term care homes to purchase and implement emotion-based models of care, providing staff training and introducing new programs that are tailored to residents' needs. Emotion-based care is rooted in a person-centered perspective. It prioritizes residents' individual needs, interests, and lived experiences. It supports smaller, more home-like living environments and is designed to foster closer, more meaningful relationships between staff, residents, and families. Evidence from these models has shown strong outcomes, including improvements in quality of life, increased social engagement, reduced pain, also positive impacts for staff, which it can include improving retention and reduced burnout. So we're really excited about this project and to continue to watch the outcomes as they come out and to expand this project in its second year. Another initiative I want to highlight is our point of care testing pilot. So this is a program that was launched in 24-25, and it's part of a multi-year approach to build capacity within long-term care homes to provide access to diagnostic services right in a home without a resident having to leave to go to a lab or to go to an emergency department. The pilot over the last 2 years has conducted more than 1,200 tests across 15 homes, and community laboratories have provided staff training and quality oversight. And now in its 3rd year, we're continuing to test and refine this approach and looking at how we can continue to focus on enhancing resident care while also reducing unnecessary transfers to emergency departments and hospitals. And I have one last program to highlight, and that's our nurse-led outreach teams. So nurse-led outreach teams are another way that our division's been working on improving access to clinical care within long-term care homes. Since 23-24, the ministry has expanded these teams to better support long-term care homes across the province. Now, a nurse-led team brings together nurse practitioners and registered nurses who work in partnership with local hospitals and long-term care homes to better integrate nursing and primary care services for residents. They work alongside long-term care home staff and have a strong focus on education and capacity building. These teams support residents with the goal of avoiding unnecessary trips to the emergency department, preventing hospital admissions, and helping to reduce the lengths of stay in hospital. And they can also play a really critical role in helping with discharge planning and enabling earlier, safer repatriation back to long-term care homes. Thank you for giving me the opportunity to speak. And I think, am I passing the torch on to Sandra?
Thanks, Emily. Good afternoon, everyone, and special hello to our residents that are joining us today and families, and also the staff from the associations that do so much to support and advocate on your behalf. So my name's Sandra. I head up the operations division at the ministry. We're a fairly large division because we are frontline and we are in and working with homes every day. So some of you will know that some of the main functions of the operations division are, number one, compliance and enforcement. Number two, the operational funding. And then there's a whole other suite of things in terms of operational work to support the homes, from making sure that homes are ready for respiratory illness season, supporting and developing the cultural homes program. So I'm going to tell you a little bit about all of those and give you an update. And many of you are quite familiar with some of them. I'll start by talking about compliance and enforcement. One of the things that many of you will know is that when our inspectors are in your homes, they will actively be looking for you. So you can expect, and you should expect, inspectors to want to talk to residents, want to talk to family members, hear what's happening if there is a family council. And so many of you will have had that opportunity to speak to an inspector. And I know from the inspections that I've been on with the team, it's always so beneficial to be able to talk firsthand and hear from you. So thank you for that. One of the things that we are continuing to grow in the regulatory space, and I always stretch my arms out wide, is that there's a continuum. So on this side is the education and outreach, and on this side is the enforcement. And we're really trying to stretch the continuum and provide more and more tools, resources, education, guidance to help homes help themselves. So some of the things that we've done this year is a series of webinars. But one of the great programs that we're looking forward to introducing in the coming year is looking at our compliance data and finding out, we already know what the areas of most common non-compliance are, and inviting homes that aren't as great in those areas to participate in a program where they would participate in a program for about 6 weeks and learn more about how they could improve in that area. Because like you, we know that most homes want to do the right thing, and sometimes they're just lacking maybe tools, resources, guidance to do so. So we really want to lean this way a little bit and offer more education, outreach, tools, and supports to the homes. We also have a role to play in enforcement. So where there is repeat non-compliance, where there is egregious non-compliance, we have a suite of enforcement tools that we will use. And it's very progressive. It starts with talking to homes, written notifications, orders to comply. And when there's an order to comply, generally it's time-based, and we work with the home to determine what would be reasonable, but also ensure that there's no imminent risk to residents. We also have administrative monetary penalties, and we can also lay charges. So those are all some of the tools that we're doing, but we're really trying to stretch the limits on either side and use a very measured approach, a risk-based approach, so that we're using the right tool at the right time for the right outcome. So please continue to share your experiences and learnings with the inspectors when they're there. Okay. And Sean just asked me a question, but the areas of non-compliance, the top 5 areas are duty to protect, infection prevention and control, plans of care, and those are quite broad. Skin and wound care is number 4. And then the number 5, where we tend to be writing the most orders, is transferring and position techniques. Okay. When it comes to some of the other things that we do operationally, some of you will know, or many of you will know, that one of the things that we also helped to operationalize is the expansion of reunification priority access beds. So now pretty well every home in Ontario that used to have 2 beds now has 4. And this is really all in the efforts to really help spouses and partners being able to live together, so that crisis applicants can live with their spouses and or partners that are already living in long-term care. The other thing you will know that's been quite a journey this year or in the past year is the expansion of the availability of cultural homes. And many of you participated in the Cultural Homes Advisory Committee and helped shape the pilot and the subsequent next steps. So we now have 61 homes in Ontario that are designated as cultural homes. And I think one of the things that it's always about helping people understand exactly how it works. Ontario has a placement model that always will prioritize people of the highest need first. But what it means is that if you have 2 people of basically the same need, the person who identifies or is looking for a placement in a cultural home that's deemed to be at the same level of need and urgency of placement will take priority over the person that hasn't identified that cultural placement request. So in no way does it diminish or reduce the opportunity for people that need a placement. The other thing I want to do a really big shout out to, because I think that residents and families have a huge part to play in this, is infection prevention and control. So one of the things that our team does in operations is that very early on every year leading up to, unfortunately, the annual respiratory illness season, is we start working really, really closely with the Office of the Chief Medical Officer of Health and with Ontario Health. And we work with partners like yourselves, and many of you participated in the webinars and information sessions we did to really start getting information and resources out to homes. When it comes to vaccination, reminding people of infection prevention and control measures and requirements, and early testing and treatment. You know, this year there was a triple threat. We were worried about both COVID, RSV, and influenza, and then we also had the advent of a new influenza variant, the H3N3. So I personally was kind of worried about what was going to happen. But because of the great effort by the homes and all of you, we actually had fewer COVID and RSV outbreaks this year compared to last year. We actually had the lowest outbreak levels in 3 years, and the overall outbreak season was much shorter than the previous last 3 years. And I think this is just a testament to the commitment by homes, the investment that they've made and the government's made in infection prevention and control, and all of our collective efforts to really protect our residents that can be very vulnerable during respiratory illness season. So kudos to everybody. The other thing I just want to share is, because we are an operational division, even though we also oversee the operational funding to homes, and we can talk more about that, but there's a lot of other things that we do that are very front facing. So many of you will know that we have a rate reduction program. And there's actually 30,000 residents that are eligible for that program. But every year we receive over 1,000 questions and inquiries about that program and how it works. And our team spends a lot of time working with families and residents to help them understand how the program works and how to access it. So it's a really important piece because the cost can be very concerning to some families and residents. And this is one program where the government can help and that our staff take a fair bit of time to help people understand it and help them apply. And I think with that, I'll end there. Happy to take some questions after others have spoken. Thank you. Thanks for everything you do.
Thank you, Sandra. And now we have Jillian, who will be speaking.
Hi, Emily. I'm just calling from my long-term care home here in Ancaster, and I'm just wondering, I just want to ensure that.
Sorry about that. We haven't reached the question and answer portion of the meeting yet. That's going to be at the end. We still have a few more assistant deputy ministers to introduce you to and to share the work within their portfolio. Next up, we've got Jillian Stevie, who is the acting assistant deputy minister for the Capital Development Division. Welcome, Jillian.
Hi, thank you. Lovely to be here. Hopefully you can hear me okay. Really appreciate everyone being here and for your questions. So thank you so much. I won't take too long on the Capital Development Division here, but really this division delivers the ministry's capital and licensing programs. So what we do is we work with partners from across the ministry and government and within the sector to deliver multi-year plans to transform long-term care by working on new long-term care spaces and also redevelopment of existing or older beds to modern design standards. This division also houses the long-term care licensing function. So that's really where all the licensing activities are performed, including but not limited to the issuances of licensing to operate a long-term care home within the province. So I'll just go through very quickly a few high-level items and updates. So we have a new funding policy that was actually announced in July of 2025. And really the goal or the focus of this funding is to advance projects and construction, particularly in hard-to-build areas around the province. So this includes not-for-profits, Indigenous organizations, and hospital operators to develop culturally appropriate and high-quality long-term care homes. The other piece that we are looking at is exploring existing processes through the development of standardized design. So this is to actually start to look at how we can ensure the standardized design within homes to ensure some improved processes to increase those builds. So really the goal is simple. It's to create better spaces to support better care, create great spaces for staff, better infection control, and more home-like environments for residents. I see that there was a question actually about a particular home, and really it's about when we're finished building a home. There are some things that we do to prepare for that home to be prepared for residents to come in, and that's where I really partner with my colleague there, Sandra, who talked about operations, and we do a look at the home to make sure that it is ready to provide safe care for residents and be a place for staff to work as well. And so we work in partnership with Ops to ensure that we have the final steps that the home is ready for occupancy of those residents. And so I believe there was a question around a specific home, but really that's where we are with that home, which is to make sure that we're ready and prepared for residents to move in. So I think that's it for me. And I'm not sure who's next on the agenda, Stephanie.
Thanks, Jillian. Next up, we have Jeffrey Graham, who's the Assistant Deputy Minister of Corporate Services. Welcome, Jeffrey.
Perfect. Thanks very much, Stephanie, and good afternoon, everybody. Thanks for inviting us this afternoon to be with you. As Stephanie indicated, I'm the ADM for the Corporate Services Division, or the Chief Administrative Officer for the Ministry of Long-Term Care. My division and my role is responsible for the overall operations of the of the ministry, make sure that it's functioning more of a behind the scenes role, if you will, compared to the other ADMs that have spoke. The other ADMs, they talked about specific programs and specific delivery and inspections and whatnot. My role and the role of the corporate services division is to make sure that all of those functions are properly moving, so that we can deliver those programs and deliver those support to long-term care homes and to residents. I think the easiest way to explain the division is we're responsible for two areas. One is our people, the ministry staff that provide support to all long-term care homes, as well as the funding. On the people side, we deliver a number of training programs and support programs to ministry staff, whether it be ADMs or directors or inspectors or right along the whole list of the staff across the ministry. As well on the funding side, I think would be more relevant to everybody on the call today. We work with the program areas with Jillian, Emily, Sandra, Sean on understanding what their priorities are year after year, programs that they want to that they're looking to introduce, so that we can develop our budget, our multi-year plan for the ministry. Once that multi-year plan is approved and the budget is approved by the government, then we work with the program areas in ensuring that funding is flowed to long-term care homes and to residents. So we're responsible a lot for the budgeting of the ministry and to making sure that the payments get to the long-term care homes. I think I'll leave it at that, Manorin. We're a bit behind on the schedule, but happy to end there.
Thanks, Jeffrey. It's so nice to have all of the assistant deputy ministers on this meeting with us today. You know, there are so many people who work at the Ministry of Long-Term Care to keep things running. And I'm muted. Okay. So thank you so much, Jeffrey. I wanted to extend gratitude to all of the assistant deputy ministers on the meeting this afternoon. It's unbelievable to see how many of you are working to improve things in long-term care and to take comments and feedback from your associations and the people that you work with who are impacted directly by the work that you do. We've had lots of comments coming through in the chat and really appreciate the respectful nature of them. I hope that you're getting the answers that you're looking for in the chat, and I do invite you to continue putting questions in the chat. Unfortunately, at this time, we won't be able to unmute ourselves and ask questions live, as we do have quite a few people on the line today. And there have been questions that were submitted ahead of time that our facilitator, Anne Donaldson, who is a resident leader, someone who lives in a long-term care home in Ontario, and also a director on OARC's board of directors. Welcome, Anne, and I'll turn it over to you for some questions.
Thanks, Stephanie. Some of these questions may actually have already been answered, but we'll start. From OARC, what progress has been made in the areas of long-term care staff recruitment and retention to ensure that residents receive quality, consistent care?
Hi, I'm happy to answer that question. So first and foremost, care that residents receive is being driven by every resident's individual care plan. That is the starting point for the care that a resident receives, not just their medical care, but also social activation, recreation, physiotherapy, all those other pieces as well. The government has invested over $2 billion per year. Over the last several years, we've seen a significant ramp up in the amount of funding that has been made available for staffing in direct care. We're now over 4 hours. Before we were at 2 hours and 51 minutes. That doesn't mean every resident every day is receiving 4 hours of care or that every single home is averaging 4 hours of care. But overall, across the system, the amount of care has really significantly increased. We've done a lot of work with our training and education partners, whether that's district school boards, public and private colleges, universities, to expand the availability of PSW and nurse training programs, for example. And we've provided the homes with significant incentive dollars to bring new hires into the home. We've got more to do, where the complexity of residents and the number of beds in the system continue to grow, which means we're going to continue to need more nurses and PSWs to deliver high quality care. And so that's something that me and my team are working on every single day. It's really job number one. We can build homes, but if the homes don't have the staff in them, then we can't provide the care that residents need.
Yeah, thank you very much. A question from the FCO. Beyond building more resident spaces for beds, what is the ministry doing to improve the day-to-day quality of care and quality of life for people already living in long-term care?
It's a great question, Anne. And I just wanted to highlight for the person who's going to answer this question, in the chat, if you haven't noticed, there are quite a few questions related to this, especially when it comes to things like recreation and what people do beyond the physical care that they receive, so the psychosocial aspect.
Yes, I've seen a lot of great questions. Also some questions around supporting individuals with dementia and the unique needs they might have as well. Not sure if I can answer every single part of this question. I can give some answer and invite my colleagues to jump in as well if there's anything additional they want to add. We're well aware that improving quality of life means focusing on how residents experience care every day. It's not just about the physical infrastructure. And it's not just about having medical needs met, right? Long-term care homes are a home, and quality of life is much more holistic. We're investing in a number of programs that bring more specialized and person-centered care directly into long-term care homes. I mentioned some of these initiatives, the Improving Dementia Care Program, some initiatives related to point of care lab testing, bringing nurse-led outreach teams in. We're also, the ministry is maintaining a fee-for-bed pharmacy capitation rate of $1,500 for 26-27 and ongoing. The only change effective April 1st is that the fee-for-bed capitation rate will not be paid in respect of unoccupied third and above beds. And we're committed to consulting with stakeholders on pharmacy services to continue to support this important high quality care for residents. I would note too, just in response to some of the questions around dementia care, this is not my portfolio, and Sandra can certainly add details she'd like, but the ministry also funds Behavioral Supports Ontario, which has staff embedded in many of the homes across the province, as well as mobile teams that provide hands-on support, training, and care planning for staff in long-term care homes to be able to provide better care to residents with responsive behaviors. And so many of the residents might have more challenging behaviors or needs related to dementia. Behavioral Services Ontario is a great clinical resources to help support them in getting the right care in the home.
Thank you, Emily. This is a question from OARC. What changes have been made to the inspection process to make it more responsive to resident concerns? You're muted.
Take
There you
myself off mute. Am I unmuted, Anne?
Yes, you are.
Okay. Thanks for the question. I think I might have already explained a little bit about this, but a couple of things to keep in mind. So even though we receive a number of complaints and a number of critical incident notifications that homes are required to notify us of every year, and just to give you a sense of that, we receive about 4,500 complaints a year. and we received several thousand critical incident notifications. So what happens is those we call them events, they tend to get bundled. So when an inspector shows up at a home, they're often addressing a number of things and putting them all together. That being said, we have quite a sophisticated, what we call a triage process, so that we make sure that if there's an immediate hazard or risk to a resident, we're out there right away. Okay.
Of course.
But in addition to responding to complaints and critical incidents, and as you know, we also have a proactive inspection approach. And so people will know, because it was a really big milestone for the ministry that last year we were able to successfully complete a proactive inspection in every home. And what we're really starting to do is use the data to inform the focus of that inspection. So rather than like look at every single thing, maybe in some homes we need to, but we're really looking at the data and looking at, there could be particular areas that we want to focus our efforts on when we're doing that inspection.
Mm-hmm.
The other thing we're putting together is, it's like a bit of a snapshot for each home, and sitting down with the home's leadership and having a discussion about their areas for opportunity and improvement, and some of the resources and supports that might be available to them. So those are some of the things we're doing. I will say there's a lot of success in long-term care. There's actually 138 homes in 2025 where the ministry received absolutely no complaints.
Wow.
I think that's a really, really great thing. Yep. And, you know, we issued just over 3,000 inspection reports, but just over 900 of them, there was no issues in terms of non-compliance. So there are a lot of homes that are doing a lot of really good things in terms of compliance. Yeah.
Wow. I'm just saying wow, because it's wow.
Yeah. And you know, that's the thing, like we only hear, I don't say we only hear, but sometimes, you know, it's the bad news that gets makes the news.
Yeah.
And there's just so much good stuff that's happening in so many homes. And it's because of all of your efforts, all of our collective efforts. Yeah.
Right. Thank you very much. Very interesting. Question from the FCO is, what changes does the ministry believe will make the biggest difference for current residents over the next 1 to 3 years?
Yeah, so I can take a little bit of this from a capital perspective and then see if my colleagues want to jump in. So I think I spoke about it a little bit, but really some of our funding policies to help support some of those harder to build areas for capital would be one place. Looking at processes and looking at some of that standardized design and supporting homes to really build the spaces, which is really the ground floor of where it all begins, and really improve some of those homes that we're talking about, and looking at renovation opportunities or other opportunities, innovative designs to help move to start these builds and to continue in these improvements, I think is really the starting point in a lot of places. So,
good.
Yeah.
Thank you. Question from OARC. What can residents' councils and family councils do to ensure their concerns and ideas are heard at the provincial level? Nobody wants to answer that. Okay, Emily does. Okay.
Go ahead, Emily.
You're on mute.
Oh, I got spotlighted. I think it's an ongoing relationship building endeavor. I think over the years that I've been at Ministry of Long-Term Care, I've noticed these relationships are developing between these two organizations and the ministry. I think opportunities like this, the more that we can be, connected directly to residents and their families, and work through these two associations to ensure that we're hearing directly from those that are impacted. And, I know as someone who, works behind a desk in the ministry, it's really impactful when I visit a home and speak with staff or residents or family members, or when I'm on a meeting like this. And I think, from the ministry side, it's making sure that when we're designing new policy or programs, we're ensuring that there's a voice for residents and families, and we're not always filtering that through academics or experts or reports, but we're trying to go directly to the source. So I think as a ministry, we can continue to do better at that, and leverage these opportunities, our connections through these organizations and through residents in homes. So I don't think there's a magic answer. I think it just takes work on both sides and building of these relationships over time. And I hope we'll continue to build these connections.
Okay. Thank you. And I'd like to thank you all at the ministry for actually giving your time to us on more than just this occasion, on many occasions. I think that it's come a long way from us not talking to you at all to us talking to you all the time. So thank you.
Yeah, well said, Anne. And thank you again. As some of the ADMs and Anne and our opening remarks mentioned, OARC and Family Councils Ontario, each association meets with our partners at the ministry on a bi-monthly basis. And when we attend those meetings, we always bring residents with us, because, we might know or think we know what it's like to live in a long-term care home, but residents know what it's like to live in a long-term care home. So hearing directly from them is so important. And we do have those frequent touch points with the ministry. So if you had a question or a comment that we weren't able to get to today, we do encourage you to reach out to us at OARC or to Family Councils Ontario. Contact information will be sent out with the recording and other supportive materials that go along with this meeting in an email. Reach out to us with those questions and comments, and we will be sure to forward those at the meetings that we attend with the ministry. Thank you so much for being here, ministry partners, Family Councils Ontario. I'm going to hand it over to Deputy Minister Peter Kafterian for some closing remarks. And please stay on after that so we could take our group photo if you'd like.
Thanks very much. So on behalf of the ministry, thank you for your time, insights, and engagement today. Special shout out for Anne Donaldson on helping with the questions and answers. You clearly have experience doing this, Anne, so thank you. And sorry we could not get to more questions, but I appreciate we were able to get to some. We really value hearing directly from you and are grateful for your commitment to sharing your experiences and perspectives with us. And we value the opportunity to continue to learn from you and look forward to continuing to strengthen our collaboration needed to support residents, families, and caregivers across the sector. And if you'll have us back on behalf of the leadership team, we'd be more than happy to do another session like this in the future if you found this helpful. Thank you.
I'm saying yes for Melissa in case you didn't hear that, Melissa.
I could hear you. Thanks, Anne.
Okay, great. So I'm not a good photographer. I think there's someone on our team who is going to do the photo. And if you're choosing to sign off now, please do fill out the evaluation that's going to pop up automatically on your screen. Really appreciate everyone being here again, and wishing you all a great rest of the afternoon. Over to the photographer. Let's see those pearly whites.
I'm curious how this works.
Me too. Oh, I see so many smiles. Look at that. I even saw some people with popcorn. You really settled in for this one.
How do we know the picture's been taken?
I was thinking the same thing. Yeah.
I've been using my snipping tool. I'm hoping that my colleague Jen is also doing the same. So we've got a few, because if I use the Zoom feature, then it makes people do a manual consent for the photo. So it slows us down. So I think we've got
yes,
shots.
I've been taking shots.
Thank you.
Good.
Yeah, and there's on my screen anyway, there's 7 screens worth of smiles to get through. So we've had to take multiple screenshots here. But I love seeing those poses. Okay, thank you so much once again. Please join us for our next webinars coming up, and we will be seeing some of our ministry partners in July for a funding webinar. So be sure to tune in for that one. Thanks, everyone. Have a great afternoon.
Thank you.
Thank you. Thanks for being here.
Thank you.
Thank you. Thank you very much.
Thank you. Take care, everybody.
Bye-bye.